I'm speaking to?
Okay, I'm Teresa Navarro. I'm the State Director for Healthcare for America Now.
And what brings you to this event today?
Well, what brought me to this event is, as the State Director for Healthcare for America Now, we need to really push for this reform. What has happened now is that we now have probably 2 or 3 bills from the House, and we are now waiting for the bill from the Senate, which is hopefully once they're back in the session, we will have some kind of bill from the Senate.
And I remember when I spoke to you in February about you were doing an event at the state legislature, kind of close to something like this. What has changed from when I last spoke to you to today?
What has changed is once the bill process has started, now that there is a bill, the extreme people to the extreme right side of it that are totally against it have now come up with hatred things. There is so much hatred going on in this country with myths, with things about death panels, with things about people are going to lose their Medicare, elderly people are not going to have insurance. All these things have now come out with the myths of what is going on in this country, which is all lies, of course, because now we have a bill. Now there is something specifically on the bill that can actually show that these myths are they're myths. You know?
And on that topic of healthcare. I understand something. Something very personal has happened that's kind of changed your perspective on this debate.
Yes. 5 weeks ago yesterday, my son passed away suddenly. My son was 41 years old. He had been on disability for about 6 years because he has back surgery, major back surgery from falling off scaffold in construction. And he has been on medication and very extreme different types of medication. He had a patch. From that patch, they had changed his medication on a Thursday. That Thursday morning, he put the patch on, and Friday morning, my son was dead. They are doing an autopsy. They're doing a toxicology report. I have been in contact with the coroner, and I'm waiting for those reports. It takes 14 to 16 weeks to find out exactly what happened, but we believe that there was a misuse of the medication. And that is so important to me because I don't believe anybody should have to go through something. The loss of a child. And it just all ties it together because I believe we have to have a public health insurance plan for everyone so that everyone can have and also be monitored electronically so that people will know their conditions, will know their medication, will have all of that service to them. And I think that's really important.
What would, sorry there, I apologize for a sec. Do you need a napkin, by the way, ma'am?
Pardon me?
Do you need a napkin by any chance? Okay. I understand that this is a very personal issue to you and to many people in this room on making sure that there's something substantial change to healthcare insurance. What would the consequence of inaction or a bill that doesn't go through do to you?
Well, what it would do to me and to millions of other people is people are dying every day in this country because they don't have health insurance. By the time that they're so ill, they go to the emergency room. What they don't tell you about it is that people are dying in the emergency room because they don't have health insurance. We have no preventative care at this time. We need the preventative care. We need something without pre-existing conditions so that people can get their health insurance. And so it would be devastating because people will keep dying in this country. Is that fair?
On the other end of that, what would a healthcare bill look like that would actually be a meaningful change from the experience that you went through?
I believe that what this healthcare bill should look like is what Obama is looking for, is what HCAN is looking for, is what OFA is, what all these organizations. We are looking for quality, affordable care. We are looking for no pre-existing conditions. We are looking for that patients can be monitored, whether you're young or old or rich or poor, it doesn't matter. We need a quality care. And we are not here to take away privatizations of insurances. If people want to keep the private insurance, keep it. But you have over 50 million people right now that don't have anything at all.
And I kind of want to go back to something you said in the first question about myths. That's been in the news lately of these healthcare myths and mistruths and the like Could you elaborate on what some of these myths you think are myths are?
Okay, one of the myths right now, I've just been talking to quite a few people, and one of their biggest concerns is small businesses. The majority of this country are small businesses, probably 80% of this country. And what I want to tell people with small businesses is you will not be, if you make less than $250,000 a year in a small business, you will not be taxed. You are not going to be forced to have insurance. It is going to be your option to have that insurance. That is one of the biggest myths that we have in this country. That is some of the reasons why some of the Democrats are not. We have Democrats that don't want to vote for the bill because they feel that those small businesses are going to be affected, and they're not.
Wow, that kind of clears up an issue there, I guess. And more importantly, I guess, and I know that you have to run a little bit here. My last question is posed to this, and I mean, it's a bit of an overview question here. We've touched on a lot of issues, very personal issues to you. I mean, some real hard issues on what change will look like. How will you guys get this done? I mean, how do you get the pressure put on to get a bill passed? But how will this be done?
It will be done by events like this. I'm leaving tomorrow to Vegas. We have a huge thousands of people that are going to be in Las Vegas on Monday. But it is by events, it's by getting out into the community, it's to talking to people. I have a coalition. My meetings are every Thursday at 12 noon. People can get on board. We bring them up to date what's going on in the legislation because we have lobbyists there every day. So it's by word of mouth, it's education, education, education.
And lastly, before I let you go, is there anything you want to say or want to touch on that I didn't touch on in this interview that you want to make sure gets out there on this issue?
No, I think you touched on everything. The most important thing is people, please, if you don't understand the healthcare plan, talk to someone, call people. Go to healthcareforamericanow.org. You can get all the information you want on the bill and actually see the bill.
Thank you very much, and I'm going to let you get back to your workshop there.
Okay.